Come, let's learn together about verbal communication strategies and OSCE. In OSCE, we use the ISBA tool for communication. It is a versatile tool for communication, and this will be used for patient transfers across these care centers or bedside handover, or when the patient is discharged, and the ISBAR format is followed among all the healthcare team members. So the acronym ISBAR means introduction, situation, background, assessment, and recommendation. In introduction, you need to introduce yourself to the health team member who is with you or to your patient. So introduce with your name and designation. In the situation, we mainly mention the resuscitation status for the patient, the current issues, and the current risk which is pertaining to the patient. And if you have made any medical reviews, that also to be included. In background, you need to discuss regarding the past medical and surgical history which is relevant to the patient's lifestyle situation, and the assistance required, assistance for mobilization and assistance for day-to-day activities, all these things. Next is the assessment. In assessment, the general assessment, temperature, pulse, respiration, BP, and the saturation level. Then all system assessment, respiratory system assessment, cardiovascular, neurological, gastrointestinal, genitourinary system, musculoskeletal system, and also any information about the IV cannula insertion date, any central lines if your patient is having any drains, and the dressings. These sorts of things have to be shared in assessment. The last one is a recommendation. In recommendation, the first one is nursing care plan. In the nursing plan, what all things comes like vital signs, then fluid monitoring, then the blood sugar monitoring, and if you have started fall risk assessment and pressure injury assessment, and if you have started any interventions, you can include all those things in the handover. And the medicine plan, like if the patient is getting any insulin, aspirin, or any antibiotics, so that medication plan should be discussed. And the multidisciplinary care plan like physiotherapy, respiratory therapy, colostomy care, all these things have to be brought up in the recommendation session. And if your patient's discharge is planned, you can come up with that details as well. So this is about ISBA technique for communication. This ISBA technique is important for OSCE exam, and also when you attend interview, some of the interviewers will ask you about ISBA techniques of communication because it is a part of NSQHS standards. It's communication for safety. Thank you.